Hi, my name is Ethan Liebler, and I'm the director of the Physical Therapy Department.
Hi, I'm John Feil.
My name is Dr. Scott Liptzin.
Here at Northern Boulevard and Rockville Center Physical Therapy, our staff has been trained on all aspects of pre- and post-operative therapies.
We have a relaxed atmosphere over here in Northern Boulevard Physical Therapy where we tailor the treatment protocols based on what the patient needs, but also we are not against listening to the patient, and if they feel uncomfortable with anything or feel like there's something they necessarily need, they may feel like they need extra massage or an extra stretch in a particular area, we're open to just whatever the patient needs and requests as well.
And right now we have 4 treatment tables here on the side. We have the electrical stimulation and ultrasound machines, which we use to set up the patients with heat, stim, ice, whatever we go through. There's the Rex machine. The Rex machine is a recumbent bike, which means that there's a bicycle that you do sitting down with the legs out in front of you as opposed to a bicycle. This is usually used for cardiovascular, warming up the patients as well as to increase their cardiovascular endurance. Usually when we start to do exercises that involves the legs, we want to warm up the legs first before we do any type of strenuous exercise to prevent injury. The UBE, which stands for upper body ergometer, which is basically a upper body bicycle. And that's going to be good for the patients that need to increase their upper body endurance, maybe not able to tolerate sitting in the bicycle, and usually good exercise to get the upper body muscles warmed up for further exercises along your exercise program. Our elliptical machine is a good cardiovascular exercise machine for including the upper body muscles, the lower body muscles, as well as coordination involving the trunk. So overall, this is going to give you a great cardiovascular benefit, which is definitely going to be a goal of some of our patients here. Treadmill is a cardiovascular machine, which is good for working the cardiovascular muscles, including the legs and the trunk. It's also great for gait training, and this is going to help our patients get back to a regular walking program that they can do on their own once they master walking on this in the rehab setting. Leg press machine is a exercise machine that's going to be used to increase the strength in the hamstrings, which is the back of the thighs, the quads, which is the front of the thighs, as well as your glutes, which is your butt muscles. And these are going to be important muscles that need to be trained to get you back to normal function. What we have here are our TheraBands and our pulley system, which we use to help increase range of motion of the shoulder joints, as well as increasing strength of the upper extremities through various exercises that we can attach to the device. The next exercise we have here is our hip abduction/adduction machine. This is an exercise machine that's going to strengthen both the inner thigh muscles as well can be used to strengthen the outer thigh muscles. Okay, this is the Roman chair. This device is used for strengthening the trunk extensors, which is going to be an important exercise that we need to include in all our post-surgical back patients. Okay, and right now he is working on his lower back extensors, and we're trying to have him go strictly to neutral so that not to hyperextend the back and cause damage in that area. Okay, the next piece of equipment we have here is the BOSU, which stands for both sides up. This is a device that we use for particularly for training balance with our patients. It involves a bubble-like surface that a patient can stand on, creates an unstable environment for the patient to stand on. It also has a stand here that we can hold on with the hands so that the patient has something to stabilize himself. And as the patient progresses, he starts taking away either a hand or 2 hands, or at some point will stand on 1 foot. The device can also be turned upside down to create an even more unsteady surface to progress our patients even further along on their treatment to increasing their overall balance. Right now we're working on dynamic balance, doing a ball toss, which changes the way his body has to react to keep him stable on the BOSU. Our abdominal and lower back exercise machine, which is going to be used to strengthen the front core muscles, which are your abdominal muscles, and the lower back muscles. He is doing the back extension, which is working his trunk extensors. Part of every treatment that a patient receives is going to be performed on the treatment table, and the things that can be done here are stability exercises, some stretching that can be done at the end of the treatment, as well as any of the massage or manual therapy techniques that may be performed can be performed while laying on the treatment table. Now that you've seen our office and our facility and what equipment we have, we hope that this will make it an easier choice for you to choose us to come for physical therapy.
Our patients are typical working or retired people suffering from various spine and brain injuries, from instantaneous catastrophes to degenerative conditions, we have experience treating everyone from those who have had surgery to those desperately trying to avoid the knife. Brain and spinal injuries often cause neurological deficits, which in turn cause other injuries and difficulties. We have experience treating all types of orthopedic conditions as well. At our offices, you are always treated by a fully trained physical therapist, and our goal is to return to normal daily functions.